You think you know the Vikings, warriors, raiders, conquerors who crossed oceans in wooden ships and carved their names into history with blood and steel. But here's what they don't tell you in the movies. These same warriors who could split a shield with an axe were also healers, surgeons, masters of a medical tradition so advanced that it would take Europe centuries to catch up. The Viking Age wasn't just an era of conquest. It was an age of survival, where knowledge of the body could mean the difference between life and death, where hygiene wasn't vanity but warfare, and where a single healer could be worth more than 10 swords. This is the story they never told you. The story of how the Vikings lived, how they healed, and how they understood something most of their enemies didn't. That survival begins long before the battle. It's the 9th century. A Viking warrior takes a blade to the gut during a raid on English soil. His crewmates drag him back to the longship, blood pooling beneath him. In most medieval armies, this man is already dead. But the Vikings don't leave him to fate. They have a healer on board, someone who studied wounds the way others study swords. This healer carries a pouch of tools, needles made from bone, thread spun from animal sinew, knives sharp enough to cut clean through flesh. And they carry knowledge passed down through generations, knowledge that understood infection before anyone had a word for bacteria, knowledge that knew how to close a wound so the body could do what it does best, fight back. The warrior's chances aren't guaranteed, but they're real. That's the difference. That's what Viking medicine gave them. Now, let's go deeper. The Vikings didn't have antibiotics. They didn't have sterile operating rooms or modern anesthesia. What they had was observation. They watched, they learned, they experimented. When a warrior was wounded in the abdomen, healers would feed him a strong soup made from onions and leeks. Then they'd wait, leaning close to smell the wound. If the scent of onions seeped through the injury, they knew the intestines were perforated. They knew the warrior wouldn't survive. It sounds primitive until you realize what it actually is. Diagnostic medicine, pattern recognition. The Vikings were reading the body like a text, interpreting signs that told them what was happening beneath the skin. They didn't have X-rays, but they had something just as valuable: brutal, unforgiving experience. And it wasn't just about treating wounds. The Vikings understood prevention in ways that might surprise you. While much of medieval Europe wallowed in filth, viewing bathing as sinful or unnecessary, the Vikings bathed regularly. Saturday in Old Norse was called Laugardagr, literally washing day. Archaeological evidence shows us combs, razors, tweezers, and ear cleaners buried alongside warriors. These weren't ceremonial objects. These were tools of daily life. The Vikings groomed themselves meticulously. They kept their hair and beards clean and styled. They washed their hands and faces every morning. This wasn't about vanity. This was about survival. They understood something profound: that cleanliness kept sickness at bay, that parasites and infections thrived in filth, and that maintaining the body was as important as training it. Think about what this means. When Viking raiders arrived on European shores, they weren't just physically stronger or better armed. They were cleaner, healthier, less prone to the diseases that ravaged medieval populations living in squalor. English chroniclers, even as they condemned the Vikings as pagans and savages, complained that Viking men were too attractive to English women because they bathed and groomed themselves. There's a bitter irony there. The so-called barbarians were more civilized in matters of hygiene than the self-proclaimed civilized world. But here's where it gets even more interesting. Viking healers were often women. In a warrior culture that celebrated masculine strength, the most respected medical practitioners were female. These weren't assistants or nurses in the modern sense. These were autonomous specialists with their own authority, their own knowledge, their own power. Archaeology has uncovered graves of women buried with medical tools, surgical instruments, herbs, scales for measuring doses. These women were healers, midwives, and possibly even shamanic figures who blended practical medicine with spiritual practice. They understood childbirth, herbal remedies, wound care, and pain management. They were scientists and mystics at once, operating in a world where the line between the physical and spiritual was always blurred. The herbs they used tell us even more. Yarrow to stop bleeding, angelica for infections, juniper berries for digestive issues, willow bark, which contains the same active ingredient as modern aspirin, for pain and fever. These weren't random folk remedies. These were tested, refined treatments passed down through generations of practice. The Vikings didn't have clinical trials, but they had something equally powerful: centuries of empirical observation. They knew what worked because they'd seen it work, again and again, in the harsh laboratory of real life. And then there's the psychological aspect. Viking culture didn't stigmatize injury the way some warrior cultures did. Scars were marks of honor, but so was survival. A warrior who lived through a terrible wound and returned to fight was celebrated not for ignoring the injury, but for enduring the healing. The sagas are filled with detailed descriptions of wounds and their treatment, suggesting that this knowledge was valued, shared, and considered worthy of remembering. Medicine wasn't separate from warrior culture. It was woven into it. So what does this tell us? That the Vikings were more than their reputation. That survival in the medieval world required more than strength and courage. It required knowledge, discipline, and an understanding that the body is a battleground all its own. The Vikings won their wars not just with superior ships and tactics, but with superior health. They lived longer, fought harder, and recovered faster because they understood something their enemies didn't. That conquest begins with self-mastery, and self-mastery begins with the body. When we look back at the Viking Age now, we see the raids and the legends. But beneath all that, there's a quieter story. A story of healers working by firelight, of women measuring herbs with precision, of warriors who knew that washing their hands might save their lives as surely as sharpening their swords. It's a reminder that civilization isn't just about art and architecture. Sometimes it's about knowing how to close a wound, how to fight infection, how to survive another day. The Vikings knew this, and that knowledge, as much as any blade, is why we still remember them.